Sometimes people leave their home, walk a few steps away, and suddenly feel a strong urge to go back and check the door again. They may have already locked it, but the thought appears, what if I didn't lock it properly? So they go back and check. Then they walk away again, and the same thought appears. The same thing can happen with the gas, stove, the oven, or other appliances in the house. A person may check once, twice, 5 times, or even more, and still not feel completely calm. Many people think this is simply being careful. Sometimes it is. However, when these thought and checking behaviors happen frequently, cause distress or interfere with daily life, they may sometimes be linked to a mental health condition called obsessive compulsive disorder, or OCD. OCD usually involves 2 related components. The first is an obsession. An obsession is an unwanted thought, image, or urge that repeatedly enters a person's mind. The person typically does not want the thought, but it keeps returning. For example, the thought might be, maybe the door is not locked, or maybe the gas is still on. Even if the person remembers checking, the doubt may remain. The second component is often a compulsion. A compulsion is a behavior or mental action that a person feels driven to perform in order to reduce the anxiety caused by the obsession. For example, they may check the lock again or repeatedly look at the stove. Some compulsions have visible behaviors, while others are mental actions such as counting, repeating words, or seeking reassurance. These actions may bring temporary relief, but the relief often does not last long and the doubt can return. Because of this cycle, OCD can be very exhausting. People with OCD usually do not perform these actions because they want to, but because the anxiety can become very uncomfortable. If they try to resist the urge, their mind may keep suggesting that something bad might happen if they do not check. It is also important to understand that OCD is not simply a personality trait such as being neat, organized, or careful. It is a recognized mental health condition that affects millions of people. In OCD, the mind can become caught in a pattern of intrusive thoughts followed by repetitive behaviors or mental rituals meant to reduce anxiety. The good news is that OCD can be treated. Therapies such as cognitive behavioral therapy, especially a method called exposure and response prevention, have helped many people reduce obsessive thought and compulsive behaviors. In some cases, medication may also be recommended to help manage. If someone finds themselves checking the door again and again, repeatedly returning to the stove, or feeling trapped in cycles of intrusive thoughts and repeated checking, it may be helpful to speak with a mental health professional. Understanding these patterns can be an important first step toward getting the right support. Thanks for watching.